It's estimated that if physicians learn to treat the causes of disease and rather than the risk factors, which is the goal of lifestyle medicine, Americans could save $1.9 trillion only, and that's only addressing the top 5. So the bottom line is, if we stepped back and started looking at prevention, lifestyle medicine, we could save a lot of money. And we go back to that slide and start adding those dollars up. So needless to say, the healthcare spending curve has got to start bending in the direction of lifestyle medicine. The MacArthur study on aging looked at the value of health promotion and risk reduction programs specifically for our seniors. Now, those of you that are baby boomers or who spend a fair amount of time with baby boomers know that that is like this huge wave. They call it the silver tsunami that's hitting the healthcare system. And the silver tsunami is going to cost our healthcare system an inordinate amount of money. Not only are these folks living longer, and unfortunately not necessarily living healthier. That's the scary part. They're living longer, but with a lot of chronic health conditions. So what we want to see modifiable health risks to do is forestall disability. We don't want these folks struggling. We don't want them out of their homes. We want them aging in place. We don't want them to have to necessarily be in assisted living centers, nursing homes, etc. We want to reduce their utilization of health services. So we actually don't want them having to run to the doctor or have multiple admissions to hospitals. And there's evidence that shows that elderly persons in better health at the age of 70 live about 2.7 years longer than those in poor health. Now, you might say to yourself, okay, wait a minute. These people are living longer. That's going to cost us more money. Look at the final bullet. Interesting. MacArthur study found that these folks who are actually healthier at age 70 and lived longer cost the Medicare system less. Isn't that unusual? Those folks that were dying earlier were still more expensive. So it's not how long you live, it's how healthy you live long. And that's a huge big deal. As we've added years to our lifespan, we've also added healthcare spending. And it's interesting that if we could shorten the period of time that people actually were ill and they lived long, healthier, we'd have significant impact on healthcare spending. This is a question that a lot of people have asked me specifically, everybody's going to live longer, is that going to cost more? And the studies are not demonstrating that.